your strategic plan. Thanks, Logan. We are now recording. All right. So welcome again. My name is Susanna Burt. I work for the Office of Substance Use and Mental Health, at least until July 1, at which time I will be moving to the Office of Health Promotion and Prevention and changing some of our roles. And that's going to be fun change. I did have a face-to-face meeting yesterday with our team, our new team, and that was kind of fun. But today we're going to discuss some alcohol policy and things that you as local community members can do. I am going to tell you right now that Rob Timmerman and Logan Reed are great resources. And that's kind of what I'm going to go over today, are some resources that you can look at for utilizing and enhancing your community's participation in shaping policy. It's not us at the state, definitely not me, because at the Division of Substance Abuse or the Office of Substance Use and Mental Health within the Health and Human Services, we don't advocate or lobby unless it ties into the governor's plan. So just remember, if it's not in the governor's budget or the governor's plan, our office isn't going to be supporting anything that's not there. We can educate and talk about it, but there are boundaries for us. But that's where you all come in, and you all have that freedom to speak and say, this is what's best for our community. We have some examples of that, how that's worked in the past. And I'm going to share a few of those. And then I'm going to share some of my favorite resources and how to find things that are missing. Like I had to struggle to find things today where I'm like, I know this was here before. There is another Heidi that's online. Is that Heidi Dutson? I don't know. There's another Heidi that's not muted, just FYI. Anyway, so first I wanted to say, again, Rob's a great resource. He's the chair of the Utah Prevention Advisory Committee with me, but he's the point person. You want him. And then the other one is Richard Nance, who used to be a director of one of the local authorities in Utah County. And he, in his retirement, has really taken some interest in the alcohol policy work group and helps shape a lot of the policy at our state level. By this, he's involved in the omnibus bill. So I hope you all are familiar with that term. It's one bill that they passed that should cover all alcohol related policy for the state of Utah. Art Brown, who is the president, is he still the president? Rob, okay. Art Brown, who's the president of the Mothers Against Drunk Driving Utah chapter. He and Richard are the biggest involved people on those prevention people on that committee. There's industry there are law enforcement, and there's also our lawmakers. They're looking for some extra support. So if those of you who are considered prevention professionals, we are inviting you to reach out to Rob or I to let us know if you're interested in being a part of that group, and someone who might be an ad hoc or a community member that is willing to put in the time to work on that policy bill. We would greatly appreciate that. But how that comes about is that a while back, they felt that every year there was new changes to the policy, whether it was looking at density, whether it was looking at how close they are to the drug-free schools or the proximity laws. We've seen the changes in the amounts of alcohol by weight or volume. We've seen access in grocery stores and in our servers. All of those things have changed or at least come under fire in the last 15, 20 years. And I'm going to show you some things today that go over that. I am not planning to speak for an hour and a half. I'm not that long-winded, and I have caffeine with me because I am exhausted for some reason today. So, but please use the chat for any questions, or honestly, unmute and interrupt me because I would totally answer that too. So what I'm going to do is that you get to see all my browsers. Oh, Brooke, did you have a question? Okay. Brooke, did you have a question or comment?
No, I'm sorry. I just got unmuted by accident. Sorry.
No, you're fine. I literally just put a big old note on my door for my kids because it's a Wednesday, which is a short day here. Don't bother me. And all the like, here are your jobs. If you interrupt me, you will get more jobs. All right, so I'm going to share my screen. Can I just put my window on here? Okay, so I'm going to do a screen first, and then we're going to go through some of the other stuff. So, ooh, this is weird. Sorry, everything changed. Was not prepared for that. So I hope you can see the Utah Commission on Criminal Justice, Juvenile Justice. Yes, okay, I've seen headlines. I'm going to go through a couple of these today, but then I'm going to point out some things about Utah that's unique, and I'll share some fun stories. I was reaching out to Liz Kelch, who is the executive director of the USAVE. So I don't know, how do we call it now? Utah Substance Use Mental Health Advisory Committee. USUMAC was what it was called, but we decided to stick with USAVE Plus because we're strange. Anyway, so we have a beer tax that we collect every year. I wanted to show you this as a resource because we have a report of where that money goes. Guess what? Prevention is not top of the list of where it goes. Surprise, I know it's so strange in this world. But what this does is that you can see where that money is going, how much money is going to your community. You as a community member have the privilege of reaching out to your county commissioners and your cities and municipalities to say, hey, I know that this money is coming here. Can you tell me what you're spending it on? Can we look at our strategic planning process and maybe see how this benefits all of us a little differently? I would discourage any of you from coming in, sorry for this like poorly thought image, but guns blazing saying, oh, we want to take the money from this group because it's a bad way to spend it. That's not how we win friends and influence people. So we want to make sure that we're looking at what's needed, and we want to have partners, right? We're all about relationship building. Let's build that relationship with our law enforcement or with our communities that are already getting the money and look at how we can support one another. There may be better, more efficient ways to use it, and that's where we come in. And maybe there's something we can do to help them. But this is a place to start for a resource. So again, that's where the websites are, and I'm going to send a list of it to Teresa. Okay, I'll send a list of all the websites that I show to Teresa, and that way you can have that as a resource as well. Another one is this is the annual report for 2020. Liz just sent me the new 2021, which is, I'd have to close out, but I'll show you that in a minute. There's also a DUI report, which tells you what new legislation has passed. Again, this can be found on the USAVE or CCJJ. That's the Commission on Criminal and Juvenile Justice, CCJJ website. And so you can see all the new things that are coming through. This is from 2021, obviously. But this is where you can see what's already in place. Because if we want to come up with policy, we don't want to do things that are already being done, or if there's something that already took away our, oh gosh, not proximity, but the mini bottles, then we don't need it. We want to make sure we just keep on top of what's there. And again, Liz Kelch, so Elizabeth Kelch, KLC is her last name, is another great resource for legislation. She does, I believe she and Rob work together to present to you all of the new bills and things that come through. We have a USAVE meeting that goes during the legislative session to keep us updated, but the real work happens before the legislative session. I cannot stress that enough, that here we are in April, they're probably already starting their plans for next year, and we'll have bills submitted to the legislature for at least boxcars or something by October. And we want to make sure we're on top of it as communities to say this is what we need to be focusing on now, rather than waiting until we hear the first bill about it. Okay. This is the MADD, so Mothers Against Drunk Driving. This is one that, again, you've got a whole bunch of different ideas for different laws. So far, we've been able to implement the most laws here in Utah. And I'm going to show you. In fact, I'm going to, how do I stop sharing? Stop sharing. And I'm going to share a different one. Again, ArtGround was a great source of information. And I got to make this bigger because there's no way you would all read it. You zoom. Because this is ridiculous. All right. So share. I'm going to share this one. Oh, I can share multiple screens. Okay. Okay, so you can see, we're going to look at this first. So this is, I know this is so much fun to look at numbers, right? I just love it. But here's what they are. So it's a status and strength. So ArtGround sent us this. This is from they did a review of the number of policies that each state had that impact underage drinking. And guess what? This has changed since 2012, unfortunately. In 2012, Utah had, and I highlighted it because nobody likes to look at numbers. I hope that's clear enough. In the green, we had all 20 measures. We're the only state that had all 20 measures. Well, guess what? Some of that's changed. So now I have to, this is a document that he sent to us that said, here's what we're looking at. These are the different policies and laws that we were considering. All of this went into whether or not you scored high on that scale. We still score the highest. So don't confuse me in saying we're not doing great, but every year things start to be eroded. And that's really, really hard when we start seeing things like, hey, we're going to let 18-year-olds serve alcohol. Or, hey, we think we're going to allow these mini bottles again, even though they're easy to conceal and easy to transport. Those are all things that are concerning. And if it's something that's valuable or concerning to you and your community and changes that community norm, we absolutely encourage you to get involved in talking to your legislators and saying, hey, this is not okay with us. Talk to your Chamber of Commerce, which brings me to one of the stories. And it's actually in Southwest. And I hope that I'm going to try and be a little elusive in case the relationships have changed. But one year, they were looking at changing the proximity of parks and where you could serve alcohol. And one of the biggest supporters of that was somewhere down in southern Utah, to where a restaurant that was next to a park was looking to have it changed so that they could have alcohol. Why do they want this? Because alcohol is a moneymaker, plain and simple. It isn't about public health. It isn't about anything else. It isn't about family. It isn't about tourism. It's about moneymaker. That's it, guys. It is a moneymaker. And I acknowledge that. That's where this company, this agency was saying, not agency, this restaurant was really advocating, like, I'm next to a city park, but I can't sell alcohol because I'm next to a city park. Well, when you have people that are going to be driving potentially intoxicated and you have a playground, guess what? That's where an issue is. But because of the UPCA, because of the involvement from the local coalitions, because my office didn't make a stance, we had UPAC did, but we did not do something from the Division of Substance Abuse and Mental Health. But we had enough people reach out to their legislators and push on that bill did not pass at that time. And that's wonderful. I mean, you probably able to see it. Yes. Oh, they were adjacent to an elementary school too. I knew there was a playground, which is why I was like, I can remember the playground. But that's not the only story. And I'm going to stop sharing again. That's not the only story where we've seen success. When I came to the state was 2006. And I want to say it was 2007 or 2008. So it's been a hot minute. And we had Lisa Michelle Church, who was the director of the Department of Human Services, had worked with some of the other legislators to essentially removed the state prevention dollars. So it was $2 million at that time, and they were lining it out. And what we saw from our communities in 2000, I'm going to say 2008. In 2008, there were so many phone calls and so many emails sent that Lisa Michelle Church came to, I believe it was Mark Payne at the time, and said, tell them to stop because this is enough. They didn't believe that prevention had this sort of setup that we could reach out to the community and educate. We weren't telling you, hey, fight against it. We're saying, FYI, this is happening. This is what's going to happen, and losing some funding, and the communities rallied. Do not underestimate your power. When we talked about the e-cigarettes, we looked at how many emails, like they're just looking at sheer numbers, the emails that were for or against to compare. Doesn't matter if it was a well thought out or persuasive argument at the time, they just literally asked for numbers. Sometimes it comes down to 6 emails. And I mean, that's a true story when I hear from a legislator like, well, I only got 6 emails total. There are more than 6 people on this call. If every one of us sent an email, that would more than double, probably triple the number of emails that people get on a regular basis. So those are the things to consider as we see these things change. Sorry, I'm closing things out. I find that when I'm looking for resources, I also go not only to my peers here in the state of Utah, but I go to my peers in other states. I found that California is a really good one, mainly because they have a lot of research tied to it. And so, I'm going to share again. Sorry, different sharing. It's always fun when you're figuring out, okay, now go away. Okay. Can I move this? Can you see that bar? Okay, well, I'm just going to move this bar real quick because I needed to be able to flip here. So this is the, let me go to my California one. So this is the alcoholpolicyalliance.org. It's based in California. I went to their watchdogging. They actually have a bunch of different websites that they follow and monitor. So I found that that's really useful for me in seeing what's coming up. SAMHSA is a great one that you can get emails from. Where is this the one? Craig and I both get, it's Stop Alcohol. Which one's my Stop Alcohol? This one. Why don't they say the name? StopAlcoholAbuse.gov. They'll send you emails on a like regular basis if you want to sign up for them. Did you know that we used to have an alcohol epidemiologist in the state of Utah that would look at the research and look at the questions that are on the behavioral risk factor surveillance system to see how alcohol was impacting our residents? Unfortunately, we lost that, which is kind of a bummer. But there is still some reports that are floating around that are good and useful for that. And if you can advocate for that grant again, if we can get our violence and injury prevention program to get that again, that would be great. But they did look at the research, and Stop Underage Drinking will help us as parents and communities to look at that. You can. Sorry. I want to make sure that you can, here it is. Sign up for the news and updates. So that's where I get it. And so I get it, it's roughly once a month. So I don't get a whole lot from, like, it's not like bombarding your emails. If you're like me, it just overwhelms me. But I do get probably twice a month an email from Center for Alcohol Policy. I know Rob's been engaged on this one. I believe this is where the conference you're looking at, Rob. If you can, I can't see him, like where Rob is. Nod your head again if this is the one you were involved again. Yes, no.
Yeah. This is the one. There's this one, and then there's also the Alcohol Policy Conference. Are you going to highlight that one? Okay.
Right.
So, yeah, both of them.
They're just both. But this one, this is the one in Nashville. You have the one that was going to be in DC, right? Anyway, don't hesitate to look into how you can enhance it, especially if this ties into your strategic plan. By raise of hand on your little like reactions, how many of you are aware that your strategic plan in your community addresses alcohol? Let me see. Do you all know how to use the reaction one? Oh, look, Teresa got a thumbs up. Good job, Teresa. Okay, some of you may just be sitting on the call, but I know at least a few more of you have it prioritized. But when you prioritize it, you can lower your hands, but when you prioritize it, it opens up an opportunity for you to find additional funding. We stress looking at risk and protective factors. And guess what? The risk and protective factors don't just address alcohol. I know that should be like earth-shattering for some people, but it does impact multiple substances. So we really look at stress, looking at those risk factors. And if you're addressing alcohol, which is one of the #1 used substances among youth in Utah, this is where we can look at other funding. But the Center for Alcohol Policy, again, I find it fascinating how much is out there. There are so many laws. Cassie, why can't I remember Cassie's last name? Cassie came to speak at one of our fall conferences when we were still having the Utah Substance Use Fall Conference. And she came out and spoke about how these laws impact our communities and at the national level, things that we can do. You know, look at what changed. I don't think anyone, there may be a few of us that can recall when the alcohol law, the drinking age changed from 18 to 21. I don't know if anyone else besides me remembers that. I know I'm no longer young, but it made a huge difference. And do you know where it made a huge difference? In lifespan. Like, isn't that crazy? Like, it changed part of our lifespan. We can see the correlation there. Same with seatbelts. Something nationally that changed, just a small little change that everyone was universally involved in and encouraged to do for health, changed lifespan. And our strategy or our goal within our jobs with our community coalitions is to create healthier communities and reducing underage drinking, increasing the protective factors for alcohol policy is one of the ways we keep our communities healthy. And this is one of the sites. I already wanted that one. I wanted to bring your attention to VIPP, so the Violence, Injury, and Prevention Program. They're going to be some of our direct colleagues. So they are our colleagues now, but I'm going to be literally next door to them in a cubicle. They've got data on alcohol. So when you go to click on the alcohol, they've got some statistics and the data here for us to look as a resource. This is one of the places that they've got some fact sheets as well. We also have on the Division of Substance Abuse and Mental Health, we have started to post the Alcohol Abuse Tracking Committee report, which is a report on all the data. It's a very, just a really, let me pull it up. I don't think I had it. But watch it not be here, because that's just, my, I know we don't have it in here anymore. See how much fun I'm having. Here it is. So we have the alcohol advisory reports. So this was in the Access Prevention Resources tab of the Division of Substance Abuse and Mental Health. Again, this will all change in 3 months. So you've got this for the alcohol advisory tracking. So you've got 2001 available. as well as some other ones. But we also have, if you go back, our epidemiological data work group system. So this is the data you can use. And I know, see how much fun I'm having trying to remember where we have everything. We should have something with, I thought our SEOW, which is our state epidemiological outcomes work group. I will find that and see why I'm not seeing it here. Because I'm only seeing that. So. But there are accessible reports that you can use in your planning and in your evaluation. That's one of the things that we kind of forget about, that especially with policy. How do we evaluate that there's change? Like I said, when we changed the drinking age, we changed lifespan. Well, guess what? We're probably not going to be doing a long-term study, but we can start seeing things change in our community that are related to our outcomes. So when we start looking at that, that's something to consider, that this will help you maybe say, hey, we saw an increase in the number of people reporting they were aware of something or using this data or the service. I think that's, oh, I have one, I think I have, I'm trying to think if I have any other stories that I wanted to share. I know that when I looked at some of the other policies we've been involved in, it was really interesting. So the Utah Prevention Advisory Committee, so UPAC, not UPCA, has the freedom to create a statement on whether it's alcohol or tobacco or other substances, because it's multiple agencies and multiple entities that are involved. We can support you in that way. But there are other groups that are not able to support or come out with a statement. And again, that's where you're really, really vital. Your relationships with your state legislators or county commissioners or city council are what shape your policy in your community. If you can co-opt them into your coalition, guess what? If they understand prevention and they get involved in those youth that are excited about policy, you're going to see a change and you'll see them engaged enough to work towards what policy you suggest. Do you all have any questions? Because I do have 2 questions that for Teresa to put on the website. Rob, are you trying to speak? I don't know what you're doing. Okay. Any questions for me at this moment in time before I share the 2 questions that I would encourage you all to answer on the Facebook page? All right, well then I will ask them in this, and you may have something that's burning right now and share in the group. So I would say describe the best way for a community or a person, so it could just be an individual, to have an impact on alcohol policy. That's the first one. I'll email that to you too, Teresa. And then the other one is in the chat right now if you want to, or on the website, whatever, or the Facebook page. But what's your favorite alcohol policy or alcohol prevention resource you use and you can't duplicate? I thought it was really cool that when I went and searched, I'm like, what are some other alcohol policies? Guess what the #1 on my search engine was? Which tells you probably how much they paid to promote it, but it's Parents Empowered. So that's a policy that was created in 2006. And not only is it the campaign that's wonderful, but it also has tied to our social host law and our eliminating alcohol sales to youth. Those are the bills that came through that year. And we forget about it because we call it Parents Empowered. Everything's Parents Empowered. Well, guess what? It's underage drinking prevention. And that's a resource, is Parents Empowered. And it's one of the #1 resources in Utah to go to. It does have some really fun videos and whatnot, but there's also content that you can use in your policy work too. So those would be the 2 questions I would put on there and encourage everyone to ask, and ask your community. If you're running a coalition meeting, ask them what they think is the best way to impact their alcohol policy. You may hear different things from different people. Someone who's in recovery may have a different response than someone who's never drank before in their life. Someone who's a grandparent or someone who doesn't have kids or a business owner are all going to have different ways to stress. This is how we can make our community healthier. And that's again why we have coalitions. I'm so glad you're all working on your coalitions. So good. Any other questions for me? I'll give you time back in your day. Gosh, you're all quiet.
I have a question.
Okay.
Okay, here's my question. Sometimes we go to these events like CADCO, or we see really cool things online and we're like, wow, that's a cool strategy. I'd like to try that in my community. Is there somewhere we can go to find out if that's even allowed in Utah? Because I know our alcohol laws are kind of complicated compared to some of the rest of the nation.
Yeah, so again, Liz Couch will tell you what's already in place, and same with the DABC. Well, we are changing our name for the Department of Alcohol Beverage Control, which is this is me. I am on recording. I am not a fan of the change, mainly because they're changing their acronym from DABC to DABS. Anyway, but we really want to keep that control thing in place. But yes, there are resources that tell you the list of all the different policy in place. But here's the other thing. Susanna's stepping onto her soapbox. If you all are working with your coalitions and you're going through an assessment, a resource assessment or a capacity assessment is probably a part of where you're at. And so that's where I think you're asking for, right, Heidi? Like assess, because yes, those meetings, those conferences get us really engaged, but maybe it's not the right fit for us. Like someone saying, hey, we want to be against the powdered alcohol, which is a thing in case you didn't know. Powdered alcohol, well, you can come back really, really excited about it, except for you find out from DABC, oh, we don't allow that at all because it has to come through us anyway. Like, so what that means for you would be, okay, we put that in a file and we remember, like if someone ever tries to legalize it, we have a strategy or something that might work. But yeah, DABC, Liz Kelch, we're going to tell you all the different policy. And I think Rob might be able to help me. I know that we have a list of all the alcohol policy that currently exists. I will find out and get that list of what currently is in place now for you, Heidi, not just you, for all of you. Because yeah, you don't want to duplicate or do something that's not effective, which again ties back to your strategic prevention framework model. Talk to me about logic models too. I'll get excited about that.
Hey, Suze, can I add?
Yes.
So yes, the DABS website has a couple of different links on it, like understanding Utah's liquor laws. And they put a lot of the major policies that cause confusion or laws that cause confusion among people here in the state, as well as tourists coming into the state there on that site. The place in Utah code, so write this down somewhere, is section 32B. That is the Utah alcohol, like that's the code, the section of code that all of Utah's alcohol laws are contained in. And then also like maybe thinking about Heidi's question a little bit, where like, yeah, you hear a good idea from a coalition in another state that they're trying to work with their community because their community is offering early bird specials at a restaurant or a bar. Well, here in the state of Utah, we don't allow that, but that doesn't mean that the bar or the restaurant in your community knows and understands that they can't offer early bird specials or discounts on beer. So that may then provide your coalition an opportunity to work with your community members, even work with the DABC, and you could either be like take the route of causing filing a formal complaint with the DABC to a restaurant, or you could simply grab your coalition chair and maybe a couple of other coalition members and go to that restaurant and say, hey, did you know that offering alcohol specials is against the law in the state of Utah? Maybe they didn't know. Maybe they came from another state and they were managing a restaurant in another state and they came and they're like, hey, let's do this. Maybe they just don't know something like that. So yeah, there we go. I'll stop now. Thanks.
That's really valuable though, Rob. And I think that the point that I heard really well is, instead of, again, accusing them of doing something wrong, co-opting them as a partner in preventing underage drinking or preventing over drinking is going to be a better strategy than saying, hey, we really want to work with you. We're not reporting you this way. We want to work with you to make better policy for your own establishment, so that you don't get caught. We like you here. We like you as a restaurant. I think that's a great way to really work with them. You said something else, Rob, that popped in my head and now it's gone. So good. But I don't want to end just yet because I was remembering. Any other questions?
I think I just wanted to draw attention. Logan put the link to that legislation in the chat, and also he just mentioned that we've had luck sending a formal letter to the coalition to retail establishment, letting them know about a law and asking them to change it. And we know we get more outcome when we're friendly with establishments rather than trying to be confrontational. So while you're thinking about that, I just want to make sure and draw attention to that.
Thank you. There are concerns with the name change, by the way, of the Department of Alcohol Beverage Service, I think is what it is. Is that right, Rob? Is it service or servers? Service.
Yeah, service.
So one of the best protective factors that Utah has been a control state. And please know, we are not the only control state, although we are dwindling in numbers. What a control state does is that we oversee the alcohol that comes in at a certain weight and volume or proof that comes in and is sold exclusively at the liquor stores. We don't have convenience stores, we don't sell wine, and we don't sell higher alcohol volume substances or beverages at convenience stores. We saw a really big change in the 5% alcohol, which, by the way, was an issue when we changed the alcohol to 5% in the stores. I don't think many people changed their drinking behavior. And when you think about that, you're drinking an increased amount of alcohol, which can be negligible for some people, but for novice drinkers, that changes things. So that's just something to keep in mind. But changing the name to service moves us one more step away from controlling the alcohol. And the intent was because they wanted to seem more friendly to the industry and to the tourism, et cetera, for the state of Utah. But again, it's about money. It's about where is the funding coming from? And when we lose the control, if we lose the control, it will increase the access to alcohol in a number of places. And I really do love walking into my grocery store and not seeing aisles and aisles of alcohol. Growing up in California, I didn't miss it when I came here, but I definitely noticed it when I went home. Does that make sense? Like, I didn't miss it saying, oh, I guess it doesn't matter because it's just not there. So I think that we sometimes think, oh, if we take it away and don't have access to it, that people are going to miss it. Not all the time. We have a very small amount of people that might be concerned, but they'll speak up. So, and don't be afraid to speak up, please. How many of you, and you don't have to raise your hand, how many of you have written your state legislator or your Congress in the past 3 years? for any topic. I mean, think about that. I have multiple times. I even talked to someone, one of our state people, and I may or may not have gotten blocked on Facebook from him just because I kept asking questions. But there are things that we can definitely reach out and impact. So make sure you are reaching out to them and knowing if you don't know who your legislators are, please let us know and we can get you that information easily. So, and Logan has put a number of things in the chat. So thank you, Logan. I appreciate that. Okay, that was it. I think we're good. Unless someone has any more questions, which I will gladly answer. Does anybody know how I can do a custom temporary tab 2 that is color? Okay. Ooh, Logan, call me. Because I have an idea that I want to do. So, okay.
Well, thank you, Susanna. I think sometimes when you're asking if people have questions, sometimes we don't know what we don't know.
Yeah.
And so those questions may come up, and don't feel free to reach out. That, you know, we can always find out things if we don't know. And I appreciate the insight, though. This is upstream prevention, you know, policy work and gathering data and being informed about these important issues. That's upstream prevention. So,
well, and I want to stress this. There are a few of us that have been in this field for a long time, and I still don't know it all. I look to Logan and to Rob a lot for my policy support because that's not necessarily my strength. So it's okay to ask others in our group. That's why you have UPCA, is to support one another in ways that you may not have all the knowledge. That's okay. I am a trained trainer in the substance abuse prevention specialist training, and I went through another SAPST a week ago, and I still learned new things. So even being really knowledgeable, like I know Rob is incredibly knowledgeable and Logan's really knowledgeable, but having the humility to say, what don't I know? And who might help me figure it out? I can go to Heidi Baxley and say, hey, what are you doing? Like, tell me more, because I don't understand. Like, I want to, like, is this something that's going to work in Weber County area? Because it might. That is why we're here. So anyway.
yeah, that's such a good point, Heidi. And I think also, I just called you Heidi. I just looked at Heidi's name.
That's fine.
Susanna, honestly, this field changes too. So sometimes we think we know things and 10 minutes later, something changes. So please keep networking. Please keep reaching out and have the humility to ask questions and share what you learn with the rest of us so that we're up to speed as well. And I appreciate Utah's networking opportunities and the fact that we just have people that stay on the cutting edge of things and are willing to share that knowledge with each other. That's super helpful.
You know, CADCA, if you guys aren't CADCA members, I find it can be a little overwhelming to have a daily email from CADCA. But every so often there's a really great like nugget in there that I'm like, oh, media literacy. Like that was the one that just struck me today. If any of you get it, the media literacy on the vaping. Yeah, Heidi saw it. But like those are things that you don't think of. And sometimes you're like, oh my gosh, people, why are you even doing that? That's not evidence-based. But those are the things, like listening to other people. Stu Fowl, oh, I could sit and listen to her for hours. So yeah, thank you.
Yeah, thanks again, Susanna. If anyone does have any more questions, this is your last chance to hit up Susanna or Logan or Rob for those things. And I'm going to pop that link for the role in one more time. just in case any of you popped on after and didn't have a chance to sign the roll. And then please remember to go to the Facebook page right after this and answer the questions so that you can be entered in that drawing. And again, if you came in late, please share the Facebook page, the website with your coalition members so that we can start getting some traffic there. And this is how we learn from each other. So thank you so much, Susanna, for your insight, and Robin Logan as well for hopping in and sharing things, your knowledge and resources with us. And thanks everyone for being here, and we will see you next month.
Thank you.
Thank you.
That was awesome, Susanna. Thank you.
Thanks. I like being all over the place, last minute kind of stuff.
Yeah,
And we're
learned
still
something
recording.
every
Would you stop recording for me?
Oh, no, thank you for that. I will do
I don't-
that.
I'll chat. Get in trouble.
Okay.